Varicose veins are enlarged twisted veins that are usually visible under the skin in the legs. Generally, varicose veins disease is not a serious condition, but neglecting some types of varicose veins might cause open wounds at the ankle or clot in the enlarged veins called thrombophlebitis. Rarely, it may even cause pulmonary emboli. Arteries carry blood rich in oxygen from the heart to all organs in the body, and the veins carry the blood back to the heart. There are one-way valves in the leg veins which prevent backward flow during the transport of blood from the legs to the heart. When the muscles in the calf contract, the valves open and the blood is squeezed from the veins. When the muscles relax, the valves in the veins close to prevent blood flowing backwards. There are three types of veins in the legs: superficial, deep, and the perforators. Perforators connect the superficial system to the deep system. Superficial veins run vertically under the skin and are responsible only for 10% of the transport of blood to the heart from the legs. The deep veins transport the remaining 90%. When the valves in the superficial veins do not work, the blood leaks downwards, causing enlargement of the side branches, appearing as visible varicosities under the skin, or stagnation of blood leading to skin changes like ulceration at the ankle level. The cause of varicose veins is unknown, but genetic tendency is probably the most important factor. It is always speculated that standing for a longer period of time, like teachers, sun exposure, tight clothes, overweight, high heel shoes can cause varicose veins, but all these postulations are not based on scientific proof, and I do not think they are responsible. There are no scientifically proven preventive measures, but there are various types of successful treatment modalities. Sometimes varicose veins appear following deep venous thrombosis, and they are called secondary varicose veins. When it comes to ordinary primary varicose veins, there are two types of primary varicose veins. In some patients with primary varicose veins, there are visible varicosities, and the duplex or the ultrasound examination reveals an abnormal leakage of blood from the groin or from the knee level down to the ankle through the enlarged superficial veins called long or short saphenous vein. But in other patients, there are visible varicosities, but there is no leakage in the superficial venous system. In patients where there is a leaking vein under the skin, and if the patient does not have any pain in the lower leg, or no cosmetic concern, or no skin discoloration at the ankle level, there is no clear indication for treatment. In patients with leaking veins, if the patient has skin discoloration at the ankle level, surgical treatment is indicated even if the patient does not have any cosmetic concern. In those patients with varicose veins and there is no leaking vein under the skin, the only reason for treatment is the cosmetic concern. It is therefore very crucial that the duplex scanning is performed and interpreted by experienced vascular surgeons or vascular technicians working in close contact with the surgeons. Wrong duplex results might lead to wrong treatment decisions. Varicose veins are typically asymptomatic, but may cause a sense of pressure, fullness, mild pain or mild swelling in the lower part of the leg, especially standing for a longer period of time. In some patients, neglecting serious types of varicose veins might lead to skin ulceration, open wound at the ankle level. Diagnosis of varicose vein disease is obvious during clinical examination. In modern venous centers, a simple and quick vascular ultrasound examination called duplex scanning is also performed at the time of clinical evaluation by the vascular surgeon. Information obtained from duplex scanning is very important for decision to intervene or to select the type of treatment. The results of duplex scanning is dependent on the experience of vascular surgeons. I've performed probably more than 30,000 duplex scanning since 1989 and remember the hesitance among vascular surgeons in Sweden when we proposed that varicose vein surgery should not be performed without preoperative duplex scanning in 1992. And I'm very glad to see now that there are no vascular surgeons left saying the opposite. The backside of duplex scanning can be the wrong interpretation, sometimes intentionally, which might lead to unnecessary operations or selection of wrong treatment modality in the hands of inexperienced surgeons.